A paramedic from Bristol whose aggressive skin cancer has spread throughout her body is about to start pioneering treatment which could save her life. Kath Osmond was given just 3 months to live at the beginning of the summer.
Her colleagues performed a Running Man dance-off to raise the £80,000 needed for the private treatment.
In a moment, we'll be talking to a cancer expert, but first, Andrew Plant has Kath's story.
She is a paramedic who saves lives for a living. But now Kath Osmond needs a treatment that the NHS can't offer. Her only hope, a private treatment which costs thousands of pounds. Ambulance colleagues helped her raise the money, and 3 months later, Kath's specialist treatment is finally beginning. This, her video diary.
As you can see, I don't look the best, even with my beautiful new haircut. You can see one of my tumours in my hair there. There's one, quite a small one.
Diagnosed with cancer, which spread to her bones, lungs and lymphatic system.
There's one here on my arm.
The treatment will take Kath's own immune cells and use them to fight the disease.
Of a revolution in cancer treatment.
In some previous patients, aggressive cancers that resisted other treatments have been all but wiped away.
Treatment that made his tumours.
I'm guessing my lung tumours and bone tumours have probably accelerated, and lymphatic, I've got quite a big lump in my neck. It's difficult to get an angle on it, but there is quite a big lump here which is very uncomfortable. You're beginning to prepare yourself for the journey ahead, so you're starting to have your sort of quiet moments where you zone out a little bit because you're kind of getting in the mindset for what's ahead. I can't say that I'm looking forward to it, but then on the other hand, I want to get on with it now.
It's expensive and it doesn't always work, but for Kath it is the final option, and it could give her the future that for a long time she was told she would never see. Andrew Plant, BBC News, Bristol.
Goes without saying, of course, that we wish her well. And Kath has just paid for part of her care, £45,000, which buys her 21 days of a treatment known as TIL. That stands for Tumour Infiltrating Lymphocytes. Well, here to explain more is Charlie Chan, who's a consultant at Cheltenham General Hospital. Thanks very much indeed for coming in tonight.
Good evening.
What is this treatment and why is it so expensive?
Well, it's a very rare form of immune therapy. So immune therapy is a concept where you try and harness the body's own immune system to fight cancer cells. And so this is a concept that people have been thinking about for the last 25 years. But the reason why this is difficult to do is that, in fact, you have to take a piece of the cancer out and you harvest the immune cells actually within the cancer. You grow them in a laboratory, which takes several weeks, and then you put them back in as supercharged cells, so to speak, back into the body to go and fight the cancer.
Why isn't it available on the NHS at the moment?
Well, people have been doing immunotherapy now for about 25 years. So the first person to do this was in America 25 years ago. But it's extremely complicated to do. It's very expensive to do. It's technically difficult to do. The results were, to start with, very mixed, with people getting very ill. And so it's taken a long time for people to bring this back on board.
The problem is that so many treatments seem to be coming on. If you're ill, can you rely on just going to your oncologists and getting the best options, or do you have to search on the internet to find what's available out there in the wider world?
Well, I think a lot of people are already using immunotherapy tablets rather than this special treatment for people with melanoma, and people are starting to use it for other cancers such as lung cancer and kidney cancer. This is all based on the fact that your cancer cells are very smart, and so what they do is they create a chemical smokescreen which stops your body seeing them. And so these drugs, which we use a lot more of, actually help and mask it. But this new treatment's very expensive and very specialised.
But will your doctor tell you the options when you go to see him or her? Or do you have to find out yourself if these things aren't proven and aren't part of the so-called gold standard offered by the NHS?
Yeah, in general, NICE is usually pretty good at trying to process through, as quickly as they can, the evidence for new drugs to find out, first of all, if they work in trials, and also whether they are reasonable costs for the NHS to pay. And really, as soon as those drugs are analysed and they seem to be cost-effective as well, then NICE will obviously put them in for general use. But in the meantime, there is a way in which people can go to their oncologist and perhaps look at new drugs which aren't yet approved by NICE.
Of course, they are very expensive, as you say.
Yeah, they are very expensive. I mean, this particular thing is extremely expensive because you have to spend a lot of time in the laboratory actually growing the cells. So this is very much tailor-made treatment, whereas obviously medicines are much more sort of off the peg.
OK, thank you very much indeed for coming in and explaining that so clearly. Nice to see you. Thank you.
Thank you very much.
Yeah, that was fascinating. Now, more